Okay. Hi, my name is Iris James, and this is my senior project for Nurse 4698. My topic is promoting cigarette smoking cessation in adults. And just the general purpose of this presentation is simple, is to educate healthcare providers, nurses, doctors, all that on how to promote cigarette smoking cessation in patients. And just some quick facts about smoking. Smoking is responsible for over 480,000 deaths in the United States every single year. More than 16 million Americans are living with a disease caused by smoking. And then for every person who dies, 30 people are living with a serious smoking-related illness. Smoking causes cancer, heart disease, stroke, lung diseases, diabetes, COPD, just to name a few. So smoking increases the risk of many disease processes, and so it's common knowledge that it's detrimental to our health, so why am I even talking about this subject? And really, and we'll go into the why in just a few minutes, but just some objectives, which again, like I said before, to assist healthcare providers in helping the patients to quit smoking. I think we've all educated our patients at one time or another on it, but obviously we need to do a better job of it because it's still a big problem. And also, what I didn't mention, but I didn't put on the slide presentation, about 40 million Americans smoke, and that's just those 18 years of age or older. That does not include adolescents. And the rationale basically just being, obviously it's still an issue. It has gone down, but it's still a problem. 480,000 deaths a year, that's a lot. And 40 million smokers, that's also a lot. So we still have work to do. What are some of the root causes? Why do people smoke in the first place? Well, smoking is a drug, like heroin, cocaine, anything like that. It is a drug, and we need to recognize that. It's extremely, extremely addictive. Many times adolescents will begin smoking because of, as a result of peer pressure. It's considered cool, and therefore they start, and they think that they can control it, they can stop whenever they want to, but then they become addicted. Some people smoke because it has a calming effect on them. They do it to relax, to calm their nerves, to deal with stress, to cope with life issues that they don't know how to deal with otherwise. Another big one is here at North Fulton, we have a lot of elderly patients. And back 40, 50, 60 years ago, people did not realize just how dangerous smoking was. So they became addicted at very, very young ages, and then found out later, oh, smoking is very detrimental to our health, and now they have a hard time quitting. So the question is, will smoking be reduced if interventions are put in place to reduce it? And the answer is yes. Studies have shown that encouragement by healthcare providers to quit smoking does reduce the risk. In our profession, we are some of the most trusted people, one of the most trusted professions. So when we tell patients something, it encourages them to do what we say. So why is smoking addictive? Well, the nicotine in the cigarettes is what makes it addictive. And when the nicotine hits the brain, it releases norepinephrine and dopamine, which just gives good feelings. And this happens in about 10 seconds. So they inhale it, about 10 seconds later, they're already feeling so much better, they feel great. And a lot of people do it for stress reduction, and other reasons too, but one of them is for stress. And Mark Twain said, "Giving up smoking is the easiest thing in the world." I know because I've done it thousands of times. So many people stop, but then they just go right back to it over and over again. So what are some things that we can do to help reduce it? Well, this is something I found as I did research. I found this as a common theme called the 5 A's framework. Ask, advise, assess, assist, and arrange. We'll go into those in greater detail. First is ask. And that is, all patients should be asked upon admission, whether that's a doctor's office, hospital, clinic, whether or not they smoke. And we do a great job of that here. That's part of our admission paperwork. Upon coming to the hospital, we ask the patients, do you smoke? We also ask about cigars, things of that nature as well, but we ask that question every time. So we're doing a great job in this regard. What advise? And this is more education. And this is educating patients on the importance of smoking cessation. And also telling them and saying, okay, you have this disease process, this is how smoking will negatively affect that. And if we tailor it to their needs and their risk factors, I think that has a bigger effect. And then assess. This is where we ask, okay, so if you do smoke, how long have you been smoking? How often? How many packs a day? I think a common thing that I hear here at the hospital is they say, do you smoke? And they say, no, I quit. When did you quit? Oh, since I've been here. Well, that's nice, but we're a smoke-free facility. You really can't smoke here. That's not really a good gauge as to whether or not they quit. And then assist. And this is where we can offer practical assistance. You know, a big thing we do here is the nicotine patches. We'll say, hey, would you like a nicotine patch while you're here? I'll speak with the doctor about getting that. And we'll look at how many packs they smoke a day, and that'll give the doctor a gauge to know how many milligrams he should order for that patch. This is also where you can give educational materials and let them know that there are such things as support groups. There are smoking support groups, just like there are for alcohol and other drugs. So this is, and then also a big part of this too is maybe helping the patient identify why they smoke. And identify, hey, are there stressors in your life that you need to address and deal with that will just take away the need to smoke altogether. And then arrange, and this is the follow-up. This is the tough part, because this is a hospital. We see the patients for a few days, they get discharged, they go home. And so this is, I think, the part where I think in a hospital setting, you probably use more work. And just, and in this one, a couple ideas I came up with this one were for perhaps being involved in case management and helping them maybe set up group behavior therapy, counseling, things of that nature. And then before a patient is discharged, make sure they're given written discharge instructions. There is a section about smoking cessation in the discharge instructions. It's just we, the nurses, have to remember to do it. We have so much on our minds all day, and 20 things are going on all at the same time, and remembering to check in their admission paperwork and say, oh, are they a smoker? And then to go from there and then add the education. And in addition, encourage the patient to schedule a follow-up appointment with their primary care provider. In some, I know with congestive heart failure, patients, we always set up an appointment with the cardiologist. I don't know if it would be appropriate to set up an appointment with the patient's primary care provider so they could get follow-up help for this, but that's something to consider. But at the very least, encourage them to follow up with their primary care provider and let them know that there is help out there. And this is so important because it'll help reduce relapse. This is a huge issue, as we mentioned before, with smoking. And then my evaluation. Well, evaluation would be in several steps. First of all, my evaluation would be from you, my audience, to see what you thought, see what I did wrong, was my ideas horrible, what can we improve upon. Second, it would be from other nurses, doctors, and say how are the patients responding to this education that we give them. And then finally, it'd be from the patients themselves. And it probably would take a year or two as follow-up is made and say, hey, you were here at the hospital 6 months ago. How's it going? Did you quit? Have you, did you relapse? Did you go back? How did we help you? Because of course our goal is the long term. And then of course expected outcomes is that we would encourage more people to quit, therefore in the long run reducing morbidity and mortality. And then conclusion, just as we mentioned before, smoking causes thousands of deaths every year. About 40 million smokers, 18 and older in the United States. Help support the patient through the process, all the way from seeing where they're at, all the way to supporting them once they decide to quit. And then finally, the battle for smoking is long from over, but we as healthcare providers should do our part to try to assist patients in this process. And I kind of want to end with something that I remember that stuck with me in the ACLS class that we took here was, it's better to do something than to do nothing. In the hospital setting, we're extremely busy. We've got things are going on, doctors are calling, families calling, everything's happening, but just even 5 minutes spent educating a patient about the risk. And for some of our patients, we have a lot of elderly. So maybe if we can't convince it to do it for their own health, maybe we can convince them to do it for their kids' health or for their grandkids. Because secondhand smoke is also very dangerous. My great aunt actually was a nurse back, decades ago, and she actually got emphysema from secondhand smoke at the nurses' stations when they were still allowed to smoke at the nurses' stations. So it's amazing how the medical advances are incredible, that we know obviously no longer smoking in the hospitals and things of that nature. But just any little thing we can do to encourage the patients will be helpful. And are there any questions?
How would you tackle someone who is using a vaporizer as opposed to a cigarette? Would you treat them as someone who, because a lot of people taper down using a vaporizer, so would you treat them as someone in progress, or would you have to, what would be your evaluation for them? I
think I would treat them in progress, as someone in progress, because I would recognize the fact that they were trying, kind of like using a nicotine patch, where you also don't want to do that for the rest of your life. But yeah, I would see that someone in progress and say to them, hey, this is temporary, to kind of help you in the tapering process, and then but eventually you want to go to nothing at all. So, any other questions? Okay. Well, thank you. This concludes my presentation.